Welcome to Highway Tomorrow, and I want to talk about a topic that's been on my mind for a while, which is healthcare. And recently I had experience getting healthcare in Germany, and it was quite an eye opener. So I think I've mentioned before that I had a type of leukemia diagnosed in 2017, hairy cell leukemia. I underwent chemo for it. It was very easy, but I was told that every 7 to 10 years it might come back. And sure enough, this last year, through a series of routine, regular blood tests that I get done, it had come back. And at the time, we were visiting my husband's parents in Poland and happened to be in Berlin. And it turned out one of the world's experts was at the hospital there. So we made an appointment and then made another appointment for chemo. Went back in October and I did the chemo. It was very simple. So I recently posted on Facebook about this, and my Facebook posting says, "Wow, crazy good news, and why I like living abroad, reason number 347. Back in October, I had chemo for reoccurring cancer, leukemia, which I guess I'll be dealing with every 7 years. We did the therapy in Berlin, and I have struggled to get the final bill so that I can submit to my insurance company. As an aside, the the German efficiency apparently doesn't apply to hospital bills. So, after everything was over, they told us, oh, it could be 4 months before we can get you a bill. And then when I finally got it, it wasn't complete. It's an ongoing issue that we're still working with. But anyway, so I had chemo for recurring cancer, leukemia, a type of leukemia, which I'll be dealing with every 7 years. We did the therapy in Berlin, and I've struggled to get the final bill to submit to my insurance company. My insurance company, by the way, is Allianz. It's an international company that I bought here in Indonesia, and I pay about $2,000 a year, and it does cover me worldwide except the United States. I also am now eligible for local government-run health insurance here in Indonesia. So I get that, and I pay 150,000 rupiah, which is less than $10 a month for that. And I've used them both. Anyway, so much for German efficiency. We had to put a little over $10,000 down, American dollars, as a deposit on treatment. So because I'm not a German citizen, I had to pay up front. The treatment went very easy. There were no complications. And we finally got a notice from the hospital. They are refunding, out of that $10,670, they're refunding to us $8,800, meaning our total cost for my treatment was under $2,000. And I know that in the USA, when I had this before, I had a health insurance plan that covered me 100% because I was working at a casino, an Indian casino, and they had a very generous health care plan. But in the normal U.S. terms, the starting rate for my therapy, for my chemo, would be around $50,000. And depending on your insurance plan, well, I don't really know what your out-of-pocket expenses would be, but a lot. And when I was on the chemo, I had 5 shots, 5 days in a row, subcutaneous, and I felt like Superman. It was like when I did the chemo, it was like I downed 2 Red Bulls. My mind was on fire. I'd go to the gym and I'd be like, yeah, The nurses even suggested that the next time I get it, I should time it with the Berlin Marathon. Because I literally felt like I could leap tall buildings in a single bound. So maybe 7 years from now, when I'm nearly 80 years old, you'll read about me placing, I doubt that I'll be number 1, placing in the Berlin Marathon. So after I posted this notice about my recovery and the cost of my medical care on Facebook, I got the usual congratulations, I had cancer, I'm cancer free, blah, 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 responses of concerned friends and citizens. From my family, from everybody, it was really wonderful. However, oddly enough, I did get a personal note from my niece's husband inquiring as to the cost difference. And he said basically, with the cheap health care you received in Germany, who pays for that? I understand it was inexpensive for you, but was the rest subsidized by the German government and its citizens? We both know that things aren't free, and someone is paying for it, whatever it may be. And so he asked me to kind of extrapolate a little more about healthcare. And of course, I can't give a simple answer. I had to write essentially an essay. And I'm going to share that with you here on Highway Tomorrow. So I wrote him back and I said, again, a very awesome question. I like my family very much. You know, I think they're really cool. So even though they're Trump supporters and, you know, they vote against gay marriage, it's a contradiction that we have in life. But anyway, I've often thought that it would be really cool if, like, we had an exchange of ideas over time. And I said to him, you know, if after reading this, what I'm writing and about to say to you, if you feel like a response, that would be really awesome. Maybe this could start an ongoing conversation about life, about love, about the social order. And it takes place over several decades. And that one of his kids, years from now, you know, finds this collection of letters and takes it to a publisher, and it becomes a major bestseller. Anyway, I think that'd be so cool. So I told him that I can't answer his question simply, that it does require some historical context. And I start off in a very broad sweep, that doctors, healers, medical people in general have always, or mostly always, been considered since the dawn of civilization to be special, to have skills that ordinary people don't have, to be able to heal and cure those in need. And I think this uniqueness is what we see in our shamanic medical providers, that either through some magic they personally possess, or some tapping into the spiritual world, or some alignment of their chakra, or whatever we want to call it, or via some naturalistic scientific knowledge, some primitive science, some advanced science. They know and have learned which herbs, which minerals, which elements can help cure. They've done this for a while. They've either been a witness or an assistant in setting a bone or in creating a poultice, and they've learned through experience over time. And I agree, that skill and that knowledge has value, like financial value. And maybe, back in the dawn of time as a peasant Bedouin, you would give that healer 2 of your sheep when they successfully deliver a baby and your wife is in good health and survives. And then maybe as time advances, that healer starts setting prices or, deciding what he trades for their services. But being a healer in human society has generally been a lucrative route for making a decent income. But now the question becomes, how did healthcare, particularly in America, become so exorbitant? Why is it so expensive? Why in this modern world is the rate of healing, the cost, so varied from society to society, from one to another? Why is it less expensive in Germany and extremely expensive in America? I think the United States is considered to have the most expensive health care in the world. And people have stories of going to other countries, getting health care for a fraction of the cost. So what's happening here? Why is this happening? And I kind of have to rely on an old memory because I am old. But I remember when I was growing up, we had personal physicians, family doctors, that we went to for pretty much every ailment, from stomach cramps to measles. And they even made house calls. They came to your house if you needed medical care. And I remember these doctors. I was in Boy Scouts. One of them was a doctor for my scout troop. And they made a good living. And becoming a doctor was a highly regarded profession. But more so because of the service they provided. And the income they received, which was good, was not really, I don't know, it just wasn't the emphasis. And I admit, I'm talking about growing up as a white middle-class American. I know there was inequality of care over race and class, and I am not ready to tackle that issue today. That definitely existed. But I think, surprisingly, there was something very personal about healthcare. And it was about the service, and it was about curing. There was a dedication to helping and saving people. And in other countries, the same thing was going on different levels. In Germany and Poland and Mexico, all around the world, again, healers, doctors were thought of, I think, in very similar terms, members of your community that you went to. You traded them a couple of sheep. You gave them money. They had a good income. And actually today, as just a little aside, today in America, at least in the United States, I don't think that maybe being a doctor is such a good course for income anymore. It's not as lucrative it was. The rising cost, the profit that is made is going elsewhere, not to the doctor. I can talk about this a little later. I think I'm getting off topic here. But my point here is that healthcare, being a doctor, was considered above the concerns of money. It was financially rewarding. It was a financially rewarding profession, but it was a service provided to society and dedicated to the Hippocratic Oath to do no harm and to serve people and be a healer. And the primary philosophy of healthcare was that it was a service, not a means to an end solely for profit. I think you can literally pinpoint the moment in history when all of that changed in America, in the United States. And it was on the night of February 17th, 1971, domestic policy advisor John Ehrlichman was briefing President Nixon on what he viewed as the advantage of relying on health maintenance organizations, or HMOs, as a key component of the U.S. healthcare system. And he used Edgar Kaiser's Permanente as an example. The HMOs up to that point in the United States had been devised by healthcare professionals and reformers who wanted to control cost, improve patient care, and facilitate coverage for the uninsured. But for John Ehrlichman, the HMO idea and model represented an opportunity to develop a private sector-based, profit-driven healthcare system. So you might ask, okay, well, what was the other option? Could they continue like they were, or could they only go in this direction? And the alternative, which remains to this day in the United States, would be a universal health care, a publicly owned health care system. And that was being proposed by Senator Ted Kennedy. Public-owned health care since that moment in the USA is derided. It's called a step towards socialism. That's the main argument that you hear every time this conversation comes up. Nixon, on the other hand, succinctly endorsed Ehrlichman's idea in this conversation, and his administration soon made it the core of what would eventually become the Health Maintenance Organization and Resources Development Act of 1973. And overnight, healthcare became focused on profit. Okay, another quick little aside. At this time, 1973, drug companies didn't advertise on television. It was considered beneath them, and it was beneath the healthcare profession. The fear was, I think, from doctors and pharmacists that patients, people would see, if drugs were advertised, people would see that and think of it as a miracle cure and then go into their doctor the next day and demand that drug. And now that drugs are advertised on TV, we've seen that happen. People come in, they say to their doctor, well, I want this, for my problem. And the doctor tries to reason with them and say why they should not be taking that medication. And so the patient just says, screw you, I'll go to another doctor. And so there's been a whole chain of events that have led to more complications in United States healthcare. Anyway, pharmaceutical companies did not advertise on TV. And I was out of college and had come home to visit my parents. I think it was in 1983. And I was watching TV with them, and I saw the first ad for a drug company that I'd seen in my entire life. And it was for a pain relief drug. I think it was called Rufen. And oddly enough, I remember this ad. And the ad talked about how cheap the product was, but it made absolutely no mention of the benefits. It was like, oh, it's for pain, but that was it. It didn't say, we've researched it, it's 100% effective, blah, blah, blah. It was all about the cost. And I think you can draw a direct line from the night of Nixon's proclamation to that ad to today's high cost. Because now today, you'll see an advertisement for a health insurance company that features a quacking duck selling health insurance on TV. A quacking duck. They literally think they can sell you this product without any intelligent perspective, explanation of what the service is provided. A quacking duck is all it takes to sell you health insurance. And I think that's a crack up, personally. I think that's really just kind of amazing. So the high cost of health insurance and health care in America is a very modern invention. It's something that's happened in the past 3 or 4 decades. It's something that my husband and my niece and her husband and their family, they've had to witness it, and they're going to suffer because of it. And in today's climate, there's a lot of explanations given for why healthcare in America costs so much. I mean, if you Google why is healthcare so expensive in America, you're going to get 4 or 5 reasons. They will tell you that this meeting with Nixon was pivotal, but they might downplay it. And certainly in the political climate of today's world, one of the things we hear is that illegal immigrants are getting free care in emergency rooms and that's driving up the cost. But, it's the health insurance industry. And we have CEOs of these companies that are living in 30-room mansions, flying private jets to testify before Congress. The total compensation for health insurance CEOs in 2023 was about $3.5 billion. The average CEO compensation was around 11 million. The median would be about 4 million. The highest paid CEO among U.S. listed health insurance company was Andrew Whitty, the CEO of United Health Group, with total compensation of 23.5 million. And recently, this was all brought to light when Luigi Mangione assassinated one of the CEOs of United Healthcare, Brian Thompson, in front of a restaurant. And that has brought to the forefront this issue of these CEOs getting paid these huge packets for merely running an insurance company. And I think at this point, I'm entitled to ask a really valid question to you. And that is, what have any of these men done to contribute to the science of healthcare, to the act of compassion of healthcare? Which one of them found a cure for cancer? Which one of them invented a new life-saving device? Anything they've ever done that would justify this type of financial compensation. Jonas Salk, who developed the cure for polio, did not even patent his product or make mass amounts of money off of it because he was a doctor who believed that his job was to do good. And I want you to think about this $3.5 billion that's used for CEO compensation. If that was used instead to provide services and treatment for the sick, for regular Americans, rather than perks and bonuses and yachts and private jets. When you ask yourself, why is healthcare so expensive in America? I think the reason is pretty obvious. So what can we do? What can America do? Every developed country in the world has a public universal healthcare system except for the United States. And Americans are terrified of this idea because of one dreaded word: socialism. How would healthcare be paid? Well, through taxes, just like other socialist institutions like the police, a publicly paid for organization through your tax dollars, essentially a socialist organization. The fire department, public schools, highways, bridges, roads, community centers, libraries. The list of socialist institutions in the United States goes on and on. But it is very much in the interest of health insurance companies and CEOs to keep the public afraid of a public care option. And they point to, oddly enough, Russia or China as bad examples. They'll say, oh, the British healthcare system doesn't really work, and they'll bring out the one or two anomaly that happens naturally in the it's never going to be perfect. So you're always going to have these anecdotal incidents of people who have not gotten good health care in a developed country with public health care. But why can't we imagine an American version of public care? One that fulfills American ideals and American dreams. Healthcare in the United States is expensive, not because healthcare is inherently expensive, but because profit margins are driven to the max in a totally for-profit system. And don't get me wrong, I'm not advocating for something free. Nothing is free. People should be allowed to make a profit. But really, an obscene profit that the CEOs of these insurance companies make? I mean, I know social research has actually said that money can buy happiness, but only to a certain point. And once your real needs are met, excessive wealth can actually bring trauma. So this ongoing argument about universal and public health care will be an issue that faces the United States, well, for years to come. If you look at the two parties in our system right now, I don't see any option or recommendation coming from the Republican side. I never have. I mean, they've never presented a proposal for reforming health care in America. Democrats have not come up with a good answer. They've struggled, and the best they could come up with was the affordable. Well, they did come up with Medicare back in the 60s. And of course, the opposition said, socialism, 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 we'll be living in Russia. And now, there are conservative Republicans who are like, don't take away my Medicare. They love having it. And literally the only thing past that was the Affordable Care Act, which we call Obamacare. And of course, that's controversial. It was fought as it was being passed and put through. The opposition side fought it on so many levels and so many restrictions that in Republican-controlled states, it was very difficult to navigate the Affordable Care Act's website and system to find health insurance. You know what? I'm going to skip all that and go on. This is not about Obamacare. I don't want to go into that. But let's just say it was an attempt to resolve this issue, to find something more affordable for people. And millions of people signed up under the Affordable Care Act. Whether you're for it or against it, millions of uninsured people were finally insured because of that. So it was a step in the right direction. But you know what? From my initial posting about my life in Germany and my treatment, I have not really answered my niece's husband's question about who paid for my health care. And I think the answer is very simple. I did. And I think he's making the assumption that the actual cost for my treatment in Germany versus treatment in the U.S. would somehow be equal. That if it costs $50,000 in the U.S., it costs $50,000 in Germany, and since I'm only paying $2,000, who's paying the other $48,000? But this is where it's so hard for Americans to understand. The actual total cost in Germany was $2,000, and I paid in full. Had I been a German citizen, the care would have been free in the sense that my personal taxes are used to pay the cost. And the reason healthcare costs are lower in Germany than in the USA is because the German healthcare system is, again, not focused on profit. Doctors get paid, nurses get paid. There are administrators paid a good salary for administrating the plan. There's not CEOs vying for stock buybacks, bonuses, and incentives. I think this is a very hard concept for United States citizens to understand. With the focus not on profit, this doesn't mean nobody makes a profit, but it means the focus is on care, not on the focus is on care and quality care and universal care. It's not about the profit line where you cut, say a patient needs a very expensive cost for care, and you deny that claim because it will interfere with your bottom dollar of profit. And denying care, this is very typical of the American for-profit system. It is the same with a nonprofit charity, for example. People are paid, there's a profit, but the focus is on the objective of the charity, not generating massive amounts of cash and income. I have to kind of go this far. I mean, I just think the American dream has gone all wrong on this idea. Somehow that we're, entitled to make as much money as possible and accumulate all the wealth we desire. Americans have this strong sense of the individual on the frontier making it on their own, the self-made millionaire. But those are myths. They don't exist. The self-made millionaire, he used your roads, your bridges, your highways to move his goods. He didn't build those roads. I mean, some of his tax dollars went to it too, but he couldn't afford to build the road that transcended America. So it's like we lose our sense of community with this very American notion of the strength of the individual. I think it's my belief that we're all citizens in this world. We're all in this community together, and we kind of have a responsibility to leave the place better off than when we arrived. Accumulating stuff is not the goal of life. I know, ultimately, everything I'm saying is silly and naive, that I'm idealistic, that my belief that we can all reach a resolution on this and help ensure and make sure that everybody gets the health care they need. But I actually kind of have a pretty good feeling that you, listening to this podcast, that you believe the same thing and that you share this vision of the world that I have. You share this vision with me. I want to thank you for letting me rabble on like this. This is Bert Cruz, and you've been on the Highway Tomorrow. Highway Tomorrow.